Duchenne muscular dystrophy is the most common and severe type of muscular dystrophy. It affects about 1 in 3,500 persons, primarily males. The nature of the disease progression requires much follow-up care. Individuals affected by the disease must have a close relationship and clear communication with their physicians.
Hi, I'm Katie Nasker, and today I have the pleasure of interviewing Dr. Francie Hsu of UCLA Ronald Reagan Hospital, who specializes in neurology and neuromuscular medicine. And today we're going to be focusing on Duchenne muscular dystrophy from a doctor's perspective. So Francie, how often do you see patients with DMD?
Thank you, Katie, for inviting me. And how often I see this special group of patients about weekly.
Great, wow. And what's the range in age of patients that you see with Duchenne?
So any age under 20.
Okay, wow. What is the nature of your relationship with your patients and their support group, their parents, the caregivers?
So we have a very close relationship in the sense that so I first met the patients and also their parents, their caretaker at the first visit. And of course, introduce myself, and a lot of times they would have a lot of questions regarding the clinical trials we do, and so we have to explain the purpose of the research, the trial, and explain to them the inclusion and exclusion criteria, which mean the requirements for becoming enrolled in the trial.
Could you walk me through a typical follow-up appointment with a Duchenne muscular dystrophy patient?
Sure. So a typical day is I went in and then introduced myself and greet the patient and the caretaker or the parents, brother and sisters, ask how they have been doing since the last visit. I like to see if there's any update from the patient and also if they have any new concerns, new questions. And the next step would be to examine the patient. I see if there's any changes in their strength, and also I would examine their gait, and afterwards we would see if there should be any need to change their medication, and that's mostly it.
Great. Could you just demonstrate a simple physical test, maybe just even using my arms, that you might test with the patient?
Sure. So basically, strength exam, first we actually start with observing.
Okay.
So observing the muscle bulk of the patient. So I would see, if this patient is sitting comfortably, if there's any joint contractures present on the exam. So I look at the muscle bulk. If there's any atrophy, then that would help me to gauge, the progression of the disease. And then the next is that I would test the tone of the muscles. So I will demonstrate per your request. Okay. So I would have patient relax their arms, and I would just kind of rotate. Okay. And then this is a perfect example of normal tone. Yeah. Awesome. And so sometimes you would feel that the patient's hypotonic, which means that they have reduced tone, so just kind of limp. Some of the neurologic patients, they will have increased tone, so it's hard to move them down. Okay. But it varies with the type of neurological diseases they have. As far as the muscles, so I would have the patient move their head down, okay, and resist me, okay, and move the head back. Okay, good. And I actually would have the patient shrug up shoulders and resist me, okay, and then do this for me, okay, and I would use my dominant hand to test the dominant hand, and so do the shoulder abduction, and do this for me, okay, and pull, good, and push, and push.
Would you say that the parents of these patients who have DMD are pretty desperate to be on any kind of clinical trial?
Yes.
Okay.
Yeah, I actually have international patients.
Oh, wow.
And their parents quit their job.
Wow.
And moved the entire family to the States in order to be become enrolled.
Wow. Thank you so much for joining me today. We really appreciate your input.
Of course, it's my honor and pleasure. I'm excited to be here.
A close, comfortable doctor-patient relationship is necessary for adequate care and treatment, particularly for a disease such as Duchenne Muscular Dystrophy, in which patients and family members are eager to do as much as they can to limit the progression of the disease, given that the patient's average life expectancy is in their mid-20s. There is no cure as of yet, but new research is taking off, and the future has never looked so hopeful.